So today, the start of another 48-hour strike called by the RMT union. However, we have learned that another union, the TSSA, has agreed to an offer from Network Rail. Does that give you encouragement that a deal may be closer in these rail disputes and a resolution could be on the cards soon?
Well, it's absolutely critical that a deal is found. Obviously, this is causing a lot of disruptions, people trying to travel around. It's also causing worries for hospitality businesses. But Labour understands the strength of feeling here. We've seen the longest squeeze on real wages for a very long period and the most intense one, actually, in living memory recently. And I have to say, these strikes do reflect an appalling failure from the Conservative government. We've only seen at the 11th hour any engagement from government ministers. For example, in the rail dispute, Labour's been calling for months for ministers to get a grip on this, to actually make sure that a deal happens, because all of the cards for that ultimately were in the government's hands. They're the ones who set the mandate for the train operating companies. And yet for months, they refused to get involved in trying to get a deal. And with nurses, we've actually seen the government saying, well, they're not going to talk about the very issue that the nurses say they want to negotiate on. So the responsibility for this, I'm afraid, does lie with Rishi Sunak. It lies with his government, which seems to have frankly given up on governing. Instead, we need to have a Labour government that can start to fix these issues, deal with these problems, not a government that seems to be just walking off the pitch.
OK, well, we'll talk about the nurses' dispute in just a moment. The government, no doubt, would argue, well, look, we've got a deal with the TSSA union. So they would say that they are making progress there. But as far as the rail strikes are concerned, are you comfortable with the fact that unions will be striking over Christmas?
Well, of course, this is going to cause disruption to people. There's no question about that. It is going to be disrupting people's plans, but industrial action is only ever a last resort. Obviously, workers lose pay when they engage in that action, and it indicates that negotiations have not been taking place in the way that they should have done. Now, yes, of course, it's positive that government ministers finally have seen the need for this, but we didn't have a single second of engagement from government ministers on this issue around the rail strikes until very, very late in the day. In fact, just over the last few hours. That is not good enough when we knew this dispute has been in place for 5 months and the Conservatives have done literally nothing to try and resolve it, with all the pain and problem that it's causing to people.
So what would Labour do? Should nurses get a better settlement?
Well, what we would do, and what we are very clear about seeking, and what we did indeed in government, and we didn't have a single NHS strike under Labour governments, what we would do is we would negotiate. We wouldn't be doing what the Conservatives have done. Yesterday they sent one of their health ministers out on the airwaves precisely to say that they wouldn't negotiate.
Okay.
For example,
so you would negotiate, but with what in mind? Sorry to interrupt, Anneliese Dodds. Sorry, we haven't got a huge amount of time, but would you be offering them a higher settlement?
We would be talking with them about the right settlement to be reached, one that works for public finances, that works for the health service, that works for patients, and that works for the staff within it. I'm not going to pluck a figure out of the air on live television. That doesn't do the process justice, because it's got to be a genuine negotiation.
But I'm not asking you to give me a figure.
I'm afraid, from the government. Well, really, this is a big problem.
I'm not asking you to give a figure, but we know what's being offered and we know what inflation
inflation
is. Would you give a higher offer to them?
Well, we would be sitting down with them and working this through. And that's why, as I say, I'm not going to, on live television, pluck a figure out of the air. That wouldn't do the process justice. It wouldn't do the NHS justice, the workers in it justice, or indeed patients. And we've not seen any of that engagement, as I said, from government ministers. We didn't even see a government minister sitting down with the RCN for months. They had the whole of the summer when the nurses warned that they were going to be thinking about this kind of action. Unless there was engagement, they did absolutely nothing. And now we have these Conservative strikes. I'm afraid they're Rishi Sunak strikes and they're Steve Barclay strikes.
OK, and the government says that it's honouring the recommendations of the pay review body. The Nurses Union argues that the picture has changed a great deal since its conclusions and inflation is much higher. So do you think that the pay review body should look again at the recommendations?
It's government that sets the parameters for these bodies to operate within. And you now have even newspapers that traditionally would be viewed as on the right of centre, conservative senior politicians, even from their own side, saying that actually the government needs to be sitting down and negotiating around these issues. That is
OK,
what
yes,
we should
which
be
is a point
doing.
you've made very clearly. But what about the pay review body? Should they look again at the recommendations that they've put out?
Well, if that needs to be a part of the negotiation, then it needs to be discussed. And I think the problem is that the Conservative government have started from a position of saying they will not talk with nurses about the critical issues for them. And let's be clear, this isn't just about pay, it's also because nurses are overworked, they're burnt out, their wards are understaffed. Labour set out a plan for massively boosting our health service, scrapping the non-dom tax exemption, using that money to increase the volume of nurses, speedily bring more into our hospitals, into our healthcare settings. Again, the government isn't delivering on that either, and I'm afraid it's patients who are paying the price as a result of this.